Hello, everyone. We are excited to present on a critical topic in the fight against HIV, specifically why pre-exposure prophylaxis, or PrEP, hasn't been more widely adopted as a preventative measure against HIV transmission. While the introduction of PrEP has been a major advancement in public health, we will explore the reasons behind its limited adoption, despite its effectiveness. We'll highlight the barriers to broader use and conclude with what can be done to overcome them. HIV transmission occurs through the exchange of specific bodily fluids like blood, semen, vaginal fluids, or breast milk from an infected person to an uninfected person, typically through unprotected sexual contact, sharing needles, or from mother to child during childbirth or breastfeeding. HIV attacks the immune system, specifically targeting CD4 cells, which are essential for immune defense. Over time, if untreated, HIV does lead to AIDS or acquired immunodeficiency syndrome, where the immune system becomes severely compromised, making individuals susceptible to life-threatening infections and cancers. Globally, around 38 million people are living with HIV, with over 40 million deaths from AIDS-related complications since the epidemic began. The virus has disproportionately impacted low and middle income countries, particularly in sub-Saharan Africa. HIV continues to be a significant public health challenge despite its advancements in treatment, while antiretroviral therapy, or ART, allows people with HIV to live long, healthy lives. HIV-related deaths and new infections persist, making prevention strategies like PrEP crucial. PrEP is a preventative strategy where individuals who are at high risk of HIV infection take a pill or receive an injection every 2 months to reduce their risk of contracting the virus. When taken consistently, PrEP can reduce the risk of HIV for those in high-risk populations, such as people with HIV-positive partners, those in high-risk sexual networks, and people who inject drugs. Specifically, PrEP works by blocking HIV's reverse transcriptase enzyme, as indicated by the arrow. And by inhibiting this enzyme, PrEP prevents the virus from multiplying and infecting new T helper CD4 cells, which are essential for healthy immune response. This protection allows the immune system to function normally, preventing the depletion of CD4 cells. By stopping viral replication early, PrEP helps the body maintain its natural ability to produce antibodies, preventing HIV from establishing an infection.
So PrEP can be a very effective preventative strategy. When taken as prescribed, oral PrEP reduces the chance of getting HIV from sex by about 99% and from needles by at least 74%. But there is a direct relationship between adherence and effectiveness, so it's very important that those taking PrEP take it consistently. In the study outlined in the infographic on the right, they saw that people who took PrEP 4 times a week had no new infections, but those who only took it 2 or 3 times a week only saw an 84% lower risk of infection, and those who took it less than twice a week didn't see any significant protection. And the graph in the middle as well showcases this relationship between adherence and effectiveness. Each color on the graph is a different clinical study, and it shows that as adherence increases, so does the effectiveness. And then we can compare this to a couple other preventative strategies, one of which being PEP, which one would take as soon as possible after exposure to HIV. And that can reduce the risk of getting HIV by at least 80%. And another prevention strategy is treatment as prevention, which describes the scenario for someone who is living with HIV. They take antiretrovirals to reduce their viral load. And if viral suppression is achieved, then there's a 0% chance of transmission. So all 3 of these prevention strategies are effective, but they are all for slightly different scenarios as well.
There are 3 main barriers to PrEP adoption. The first one being costs. PrEP medications can range from $1,500 to $2,000 a month, and even generics can be $30 to $75 a month. Oh my gosh, okay. And that's not including regular doctor's appointment and lab testing, which can range from $100 to $300 a month. Also, even with insurance coverages, which are super inconsistent, out-of-pocket payments like co-payments, deductibles, and prior authorization requirements can really weigh on the costs. This graphic just shows the costs, the out-of-pocket costs compared to the abandonment of PrEP, and as costs get higher, more patients abandon PrEP because they're not able to afford their medications. The second barrier is accessibility. There's a lack of specialized clinics, especially in underserved or rural areas. And the underfunding of these clinics can lead to long wait times, shortened clinic hours, inadequate amount of staff, and just overall knowledge the staff have can be limited, including just like prescribing the correct form of PrEP that is best for a patient, or you know, seeing if someone is eligible for PrEP, which is just a lack of consistency overall in prescribing PrEP. And this graphic just shows the comparison of urban New York to a rural Southern Illinois, and how PrEP like awareness was, and how media coverage affected conversations that led to actual correct knowledge of PrEP compared to in the rural area. There was radio campaigns which did not contribute to conversations, and none of the people in the study could correctly describe PrEP. And that's the main points of that graphic. The third barrier is awareness. There are a lot of misconceptions and biases of HIV and PrEP. A lot of them have to do with who is eligible for PrEP. So a lot of people have the misconception that only homosexual men can take PrEP, or that people confuse PEP with PrEP, and that you have to have had an HIV exposure to take PrEP. These are an example of some of the campaigns that help lead to conversations about PEP and PrEP, and there's also outreach programs that can help to contribute to those conversations and overall knowledge of PrEP.
So going off of those barriers, this shows itself in different disparities regarding high income countries and low income countries. And then if you zoom in a bit, it has also a lot of gaps in urban areas versus rural areas. So when you look at North America, which is, is filled with high income countries, compared to sub-Saharan Africa, which is filled with low and middle income countries, countries like the US and Canada have better implementation because they have programs to subsidize the medication and overall implement health strategies to prevent HIV transmission through PrEP. Countries within the sub-Saharan Africa region often have these barriers like cost and limited healthcare infrastructure and lower awareness, which ultimately doesn't give them access to PrEP, and then they end up just spreading HIV even more. When you look at this example of urban versus rural areas, for instance, within the United States, there are still disparities that happen within these smaller geographical areas. So even though the United States is a high income country, it still has issues within the country. So urban areas are more likely to adopt PrEP because there are more healthcare facilities, clinics, and LGBTQ plus populations. So generally, larger cities usually have larger public health campaigns, as you saw, while rural areas suffer from underfunded healthcare and stigma surrounding HIV. In this slide, you can see how that applies. In the bottom side, it shows the adoption of the WHO recommendations on oral PrEP, which is a good amount of countries, the ones in green. But then when you look at the one on top, these are the number of people who have actually received oral PrEP, and it significantly drops within sub-Saharan Africa and countries that seem to have adopted the WHO recommendations. Next, I'm going to talk about social disparities. One of them being gender disparities, where you see this huge gap between women, especially in sub-Saharan Africa, compared to, say, men who have sex with men. These women are at a higher risk of infection because of gender inequality, low healthcare access, and a lack of general education. And as a result of this, mother to infant transmission is much higher than it really should be. And another social disparity that I'm going to talk about is socioeconomic disparities, where lower income individuals have bigger challenges in accessing PrEP, such like similar to how lower middle income countries have that issue as well. So for instance, in the United States, health insurance plays a critical role in accessing PrEP, but a lot of people are either not covered by insurance or have inadequate coverage. So they're not able to afford the medication. And then there are also associated costs with it, such as the doctor visits, lab tests, transportation to get to all of those things. So those create even more of a gap. And then you can see here the significant stark difference between men and women who receive PrEP prescriptions, with men being at 41% and women being at 15%. So it's definitely a gap that needs to start closing.
Access to PrEP has significantly improved through policy changes and cost reductions. In countries like South Africa and Kenya, public health programs now include PrEP, making it affordable. In the US, generic PrEP has reduced the cost, increasing affordability. And mobile health clinics like the unit shown here are crucial in reaching underserved rural populations, providing access to testing and PrEP without long distance travel. And this is especially vital in low income areas where transportation and healthcare access are significant barriers. Public health campaigns like this billboard have successfully made PrEP more relatable, using casual and accessible language to reduce the stigma and appeal to younger audiences. Social media influencers are also driving awareness through platforms like Instagram and TikTok, where storytime videos share personal experiences with PrEP, making it feel less medical and more as a part of daily life. Combined with education programs in school and community centers, these campaigns help broaden understanding and acceptance of PrEP, reaching diverse audiences both online and in person. Innovative methods like long-acting injectables, which require a dose every 2 months, are making PrEP easier to use, especially for people who struggle with daily pills. So telemedicine is also expanding access by allowing people in remote areas to consult doctors and get prescriptions online. Mobile clinics continue to bring PrEP and follow-up care to underserved communities. Together, these strategies are transforming PrEP delivery, making it more accessible and practical for everyone.
As a short summary, PrEP is a medication you can take prior to exposure to HIV to prevent infection. When taken as prescribed, PrEP reduces risk by 99% from sex and 74% from injections. PrEP is not adopted as a result of high costs, lack of accessibility, and lack of education and awareness. PrEP is the least accessible in areas that need it most, including sub-Saharan Africa and rural locations. PrEP is significantly less accessible for women and low-income individuals. In the US, PrEP is often not covered by insurance, sometimes making it unaffordable even for those who do have health insurance. Since there is currently no cure for HIV or AIDS, the most effective strategy is prevention. Increasing healthcare coverage for PrEP, introducing generic PrEP and cost reductions, and expanding healthcare coverage in underserved areas are all effective measures to increasing access. Lack of education and awareness has an alarming impact on the spread of HIV. As of 2024, about 1.2 million people in the US who are HIV positive, 13% are unaware. This is about 156,000 people. As an individual, raising awareness and reducing the stigma surrounding HIV and PrEP can have a significant impact on encouraging people to become aware of their HIV risk and start PrEP prior to infection.